Good morning, everybody, and welcome to another edition of Viewpoint the Conversation, the glaucoma special right here on Solid 100.9 FM. And it is Tesha, the Eye Specialist Hospital, Enugu State, Public Enlightenment Glaucoma Program. My name is Chibika James, and it's always a pleasure bringing this life-changing conversation with you all. Now, I want you all to imagine being told that, no, we're not wishing for anybody, okay? But imagine being told that you have an eye disease that may not completely go away, but can be controlled. You receive medications, perhaps eye drops, maybe laser treatment or surgery. At first, you are diligent. Then weeks later, life gets busy. You miss a day, then another, and before long, you stop taking your treatment altogether because your eyes still feels fine. And unfortunately, that is how many people gradually lose their sight. Now, one of the biggest reasons people go blind from glaucoma isn't because treatment doesn't exist. No, it is because treatment isn't followed consistently. So today's discussion is therefore one of the most important that we have had in this series. The topic is stick with it, save your sight. Stick with it, save your sight. And it's all about adherence to treatment for glaucoma. Adherence to treatment for glaucoma. And today we will be discussing why sticking faithfully to glaucoma treatment matters. We would also talk about the dangers of stopping medication without medical advice. We would look at common reasons people abandon treatments and practical ways patients can stay committed and protect their vision for life. And joining us in our regular glaucoma specialist from the Eye Specialist Hospital Enugu, Dr. Suhaya OKK. Good morning, ma'am, and good to have you.
Good morning. Good to be here.
Okay. For the topic, stick with it, save your sight, adherence to treatment for glaucoma. Ma'am, first of all, let's start with the basics. Just like how we always do every Fridays from 9 to 10 a.m. What is glaucoma? And why should our people be worried?
Thank you. Glaucoma is a blinding eye condition, and it is quite common amongst black people and more common amongst the Igbos. And one of the painful things about glaucoma is that if you get blind from glaucoma, you cannot get back the sight you have lost. So a stitch in time saves nine. You have to be really proactive. What we are saying is, if damage has started occurring, any damage that has started, we cannot retrieve that part of the damage. It's only that those fibers that are still viable we can recover. Because of this single nature of glaucoma, it is highly important we pay attention to the eye health so that we can come for regular checkups, so that we can preserve that sight that has silently helped you to navigate your way, navigate your life, navigate almost everything. Your daily existence revolve around these two little organs sitting on top of your face. So it is important to appreciate these are helping you see, and let us also help them to be in good health. It's just like having a car, and if your car is working, we all enjoy the car. At the end of the day, there are some little part of maintenance we are supposed to do, and when you don't do the maintenance, the car knocks engine and we all pay the price. And we don't want these little organs to spoil such that it cannot be retrieved. And when they fail, it's darkness. And darkness is not one thing we want to subscribe to in our life. So let's do everything possible so that we can save this site, so that your independence, even at your old age, will be assured.
Even at your old age, you definitely have something to bank on. But ma'am, what exactly do, talking about this, our conversation for today, which is stick with it, save your sight, and adherence to treatment for glaucoma. What exactly do doctors mean when they say adherence to treatment? Because many people hear this phrase but do not fully understand it.
Exactly. Thank you for that question. Now, what do we mean when we say stick with it? Okay. One of the major components of glaucoma care is medications. Those are the eye drops. We have other modalities, which is the surgery and laser. But for the purpose of our discussion here, we are talking about the eye drops. Now, glaucoma medications are very tiny. They are in bottles. The bottle top comes in different colors. The sizes may be almost about the same, but the frequency may differ. There are different classes of drugs that are prescribed based on the nature of glaucoma and the level of eye pressure your eye is experiencing. Usually, when after all the investigations, your doctor examines you and set a target pressure and tells you this is the ideal pressure for you, below which further damage may not occur. And because of that, each time you come to the eye clinic, check your pressure. If this pressure, you are supposed to maintain this pressure for your good eye health, so that damage doesn't continue to occur. To achieve this is not usually automatic. Some eye drops are given to you. When these medications are given to you, some are given only to be used at night. Some are given so that you can use it 2 times daily. Some are given such that you can use it 3 times daily. Some are 4 times. So depending on the frequency means the number of times you are instructed to use those medication, you are supposed to use it as prescribed, because when you use them the way it is prescribed, most of the time your response in terms of eye pressure reduction, pressure control is very good, is optimal. But when you use it, I have forgotten, my doctor told me to take this medication but I missed. You missed 1 day, you missed 2 days, you missed 3 days, you come back, you rush back because the eye now begins to complain. You come back, you're not doing any good, okay? Because the eye cannot express itself on daily basis. When you take the drugs, the eye feels happy in terms of eye pressure. Things are under control. It may not be talking to you, I am happy, I am very well, but it is silent, and some of the few complaints that is mentioned may not be there. So your life moves normally. But over time, when a patient keeps taking the medication, you get tired using the medication. You even I have had quite some number of patients asking you, doctor, is this drug not too much in my body? Such that you have a feeling my whole body is now eye drop. Why am I taking this eye drop?
And some will even say that my eyes are no longer hurting me. I can see.
So why do I have to take it? Just know that these eye drops, they work well for that period of time. If they are for 24 hours, most of the time it is once daily. Their effectiveness cannot exceed that 24 hours.
Right.
If it is 2 times daily, that means the drug can be effective for 12 hours. If it is 3 times, they are effective for 8 hours. So that is the elasticity they have. So if you are not using and you want to give yourself a drug holiday for 1 month, that eye is not happy with you. By the time you come back and remember the eye, that damage that was at 70 or 80% or 90% has now moved another goalpost to maybe from 90 to 93%. It keeps moving. And remember, you cannot get back from 93 to 90. You can only move 93 to 94. Our struggle here is let you be at that 90% where you were, so that the damage doesn't continue.
Okay, some patients stop using their eye drops because they think that the surgery or the laser treatment they have had cured them. Does that happen? Does the laser cure and stop the use of eye drop? And is glaucoma ever cured, even with the laser and the surgery?
Yeah, I want to just remind ourselves that our topic of discussion here is medication, and stick to the medication. Now, glaucoma has other treatment modalities like laser and surgery. And if you have done a laser, most patients, those that have early glaucomas, may not be on any eye drops. Okay? The pressure reduction is achieved with the help of those medication, the laser itself. Now, what we tell them is still come periodically for evaluation, so that the doctor sees your eye, measures your pressure, and check other parameters to be sure that that laser that was done to you is still working very well. And usually after 1 year, all investigations are repeated to be sure that the efficacy of that laser in your own eye is good, is optimal. Likewise, if you do a surgery, glaucoma surgery, you are not going to be on glaucoma medications. You might be on some other medication, or most of the time you may never be on glaucoma medication if the surgery works well. So at other times you might be on one eye drop or so. So there are modalities under which medications are given. It is your doctor that directs you how these things are handled. Mr. A, who did laser, is not on medication. Does not mean Mr. B, who did laser, may not be on medication. 2 of your eye pressures, 2 of your stages of glaucoma, 2 of your coexisting conditions may differ, and your targets may differ, and based on that the doctor will add or not add a medication. The aim here is to achieve the target pressure. Once the target pressure is achieved, you are fine. Sometimes a patient has a target pressure of 9. Sometimes a patient has a target pressure of 14. Sometimes a patient has a pressure of 18. So 2 glaucoma patients discussing among themselves cannot compare. Oh, my pressure is 18. One patient says my pressure is 9. Two of them cannot say one is doing better than the other. It is left for the doctor and your information you have gotten from your doctor that this is your target pressure. Am I at the level of target pressure, or am I not at the level of target pressure?
Yeah.
So all the treatment that is available is aimed at bringing your pressure to the target pressure. So that is why you have the drugs that are doing the work, you have the lasers, you have the surgery. For those that are on medications that are the eye drop, please, the options is you must stick with your medications. You must stick with your medication. For those that have done the lasers have done greater part of their work. That may be the reason they are not on medication. Likewise, surgery lowers the pressure, so they may not have a reason to be on eye drop. Okay.
All right. Thanks for clearing that one. We also have situation where people say that they don't really understand why adherence to their medication is difficult. What are the common reasons that patients fail to stick to treatment? I would like for you to discuss about on this program we have talked about some forgetfulness, cost of medication. Sometimes complain of the side effects of those drops, busy schedules, lack of understanding. Traditional medicine, they will say, oh, I go and drink one this and they say I should not mix both. Prayers without medical follow-up, they say our pastor say I'll see in Jesus' name and I don't need drug. And the fear of lifelong treatment.
Yes, you have hit almost all the points. Now, it is true. One thing is forgetfulness, and when you are taking a drug every day, it can become for a disciplinarian, it becomes part of your life to take it. And after all, we eat 3 times food, and we don't call it bothersome, because eating goes with joy to some extent, and because there are taste modifications and all that. This one is somewhat burdensome because it doesn't give, you don't feel the value of it when you are taking it. You have a feeling, oh, this doctor told me to be taking it, but you don't see the improvement. When you put the eye drop, it's like when you take anti-malarial, you take an injection, you go to the clinic, you come back happy. 1 hour after, that fever has gone. So you have a feeling, even if it is injection every day, let me take it and you get well. But unlike this situation, this malaria situation and malaria drugs, glaucoma medications cannot show you green light, or your sight is improving. It is worse for somebody whose sight has gone down and he's spending so much money. The painful thing is glaucoma medications are very expensive, and when they take this medication, you don't even see that your sight is improving. So you have this natural frustration. Oh, I spend so much money, I take my drugs, yet I am not seeing the benefit of this drug. So is it worth it after all? You now tend to seek for alternative care. That is where the prayer houses come in, holy water comes in, and all sorts of things, including the traditional herbal medication and all that. But can they really do any help for you is an important question.
True.
Because yes, you are frustrated genuinely, but can this alternative treatment help you? Prayers In as much as we take our drugs, it is always give your heart to God and tell your God to help you secure your life. But then you will not take that prayer as an only window to heal yourself. It may never heal. I think I have long been told, if you do your best, God will do the rest for you.
Yeah.
So you just have to do your own part, which is seeing the doctor, taking your medication. If your medications are 3 times, please do it so that effort you are putting coupled with your prayer will work. Now, when it comes to native medication, we have these drugs don't really go through trials, and they are not tested that they have used it in this number of patients and it has been effective or anything. So we are not too sure whether it is going to help you or not. To make the matter worse, they are also not made in hygienic condition. Percentage of materials that are added, nobody is sure. The safety protocols not observed. Sometimes you even hear that they add sugar solutions, breast milk, and all that. So these things are not actually healthy for your eye. Now, instead of facing glaucoma, you are going to face corneal ulcers, which can still be blinding condition to your eye. So you don't need such treatment. It is important to know that alternative care may not have a role to play in when you have glaucoma. What you can do supportively is to take a lot of fruits and vegetables, a lot of green, red, yellow, purple vegetables, bright colored vegetables. These ones naturally give you what you call antioxidants. They have the potentials to mop up harmful toxins, we call the free radicals, which can damage the optic nerve. When it damages the nerve, it gives rise to glaucoma also. So that one can be very, very useful.
Yeah.
But don't go taking herbal medications and say that is the way. Sometimes our patients also believe that those drugs that were sent from Obodo, the one that your daughter or son sent to you, most of them are supplements. I don't have problem with supplements, but the problem now is taking your drug aside, keeping them on one side, and say
supplements for the drugs.
Yes, substituting the supplements with the drugs doesn't help, because you have lost the major chunk of your treatment.
Okay, in a situation whereby, a person missed treatment for 1 or 2 days, is it really a problem?
Not really, as long as you get back. We are human. You can, to err is human. Sometimes pressure, schedule, and all that, one can miss it, but you make conscious effort to come back to your medication. When it gets wrong is that 1 or 2 days become a cumulative thing. You start forgetting. 1 week, 1 month, 1 year. We have seen patients coming after 2 years of non-use of drugs.
Wow.
Yes, so these are the things we are talking about.
Right.
And for those that are that have heavy schedule, I know when you have heavy schedule, that's the nature of life today. You can actually key in some of these activities in your phone, such that the phone sends you reminders that it is time to, is not only time to wake up, time to put your eye drop. So it makes it easy. At 12 o'clock you take this drug, 1 o'clock you take this drug. It can work. If you are in a meeting, you can carefully sneak out and go and use your eye drop and come back. It's possible.
Very possible. Well, ladies and gentlemen, if you're just joining, well, you have missed quite a lot, because today we are discussing Stick With It, Save Your Sight, and it's all about adherence to treatment for glaucoma, and we are talking about the use of drops. And right here in the studio, I've got the Dr. Suhaya Okeke from the High Specialist Hospital, Enugu State. We will be talking about practical ways where patients can stay committed and protect their vision. This program comes every Fridays from 9 a.m. till 10 a.m. and it's championed by Solid 100.9 FM as well as the Eye Specialist Hospital Tesh, Enugu State. Well, having talked about practical ways, the doc talked about setting phone alarms. Aside from phone alarms, are there other practical ways that a patient can use to remember to take their medications?
Yes, please. There are ways we can remember, like there are patients who are daily planners. There are patients who are weekly planners. You could keep your night drugs if you are, for all of us that have night drops, it is always easy to keep your drug by the bedside so that you know the last thing in the night, no matter what you do, you will meet your bed to sleep.
Yeah.
And you know that drug is on your bedside. So even if you have forgotten, at least the drug is glaring at you. Apply your drug before you close your eye. That should be the one that you use at night. Then for those that have 2 times daily drug, you still start in the morning and end in the night. You can still keep them at the bedside and take the night drug along with the other one. But the month you know you have a morning drug, you identify the familiar place you must always get to in the home. For instance, a dining table where you come to take your breakfast, or in the sitting room where you sit down to make your call, or your office table. Keep your drug, your medication where you see yourself most of the time, so that it doesn't escape your mind. And you could just put a tag there, this is your morning drug. For those that have afternoon drug, make it a habit of taking your drug along with your afternoon meals. So before you take your meal, just put your eye drop in your eye before you start off with your meal. That way you know that when you eat your food, you can be tired and you can actually forget your drug. But by the time you take your drug and you continue with your food, you don't even know that you have taken your drug. Now, also remember that it's not everybody that is only on one medication. Some are on 2, some are on 3, some are on 4. So now the challenge is, if you have multiple medications, you must endeavor to remember the drug. And in between your medication, always remember to give yourself at least 5 minutes interval. That is very important, because if you apply many eye drops at once, the likelihood of not all of them entering your eye is very high. Now you also know that your drugs are expensive, and these are like going to the waste bin. So what you do is give yourself 5 minutes interval, apply some pressure at the corner of the eye. I'm sure your doctor normally teaches you how to apply your medication, and give yourself 5 minutes interval so that you get the maximum benefit of those medications you are using. So it is very vital to do all that.
Right, very vital. Well, ladies and gentlemen, let's open up the phone lines and take your calls. So if you've got questions to ask, We already see your call, so keep your call coming. The number to call 0704 550 2840 0909 771 1009, and you can also call 0902 311 1009 if you've got a question relating to our topic or any eye related issue. Feel free to call, and I'm sure Doc would definitely give you a befitting answer to your question. Once again, 0704 550 2840 0909 771 1009, and you can also call 0902 311 1009. All right, Doc, this one quite a very interesting one. It says that message I just got. It says, how important are follow-up appointments? Because many patients buy eye drop reportedly, but never return to the hospital. Why is regular review essential?
Should I go ahead?
Yeah, go on.
Yeah, very important question. Thank you for that. Now, follow-up visits are very, very important because if you are using medications or if you are on any treatment, the only guide is when you see your doctor, the doctor assesses your eye, checks your eye pressure. Not only that, he checks your eye pressure.
Doc, hold on. Let's take this call. Hello, good morning.
Hello, good morning.
Yes, good morning to you.
Please, my name is.
Your name is who?
My name is Oyebuchi.
Onyebuchi, good to have you.
Okay. Please, I have a question.
Go on.
I have a friend I'm helping to do. I used to take the person to the hospital for eye checkup.
Mm-hmm.
So, but I found out that the last time we went there, they don't have eye drop we're supposed to get. So they referred us to get the eye drop from the chemist. So we went there, and we found out that the cost price they are selling it in the hospital is very high than the one they are selling at the chemist. So my question now, is it advisable to get some of all these drugs without going to eye checkup in that hospital?
All right.
So is it advisable for us to bypass those eye checkup and
wait. Let me get your question clearly. If you have been given drop to go and get, are you asking if it's advisable to go and get that drugs outside and not in the hospital, or without checkup? Since they say get drug A, you always gonna be buying drug A continuously outside.
Yeah, no, we have been. That is that the same drug we are getting? So they refer us because they don't have it that day.
Oh, okay.
So, but when I went to get it, I discovered that the cost price is very high. So my question now is it advisable for me to just go to the clinic?
Okay, I get the question now. And be getting the drugs continuously now.
Yes.
Right. Well, this is something we are almost talking about. So, Doc?
Okay, let's go to the first caller. How important are the follow-up question? Follow-up visit. Follow-ups are very important because the doctor, not only that you are checking your eye pressure when you come, the doctor checks the health of that optic nerve. That optic nerve is the wire that sends the message to the brain. Sometimes your pressures can still look normal, but maybe that nerve is not looking healthy. So the doctor now raises his antenna and looks at your eye and does some modification, changes your medication. Sometimes everything is normal, he can leave you with the prescription. Why it is important? Sometimes patients also feel that you come to the hospital, you keep getting the same prescription, so why do I have to go again and pay that bill to get and suffer the day getting there? Now, if you are stable, your doctor may not be in a hurry to change your medication, but sometimes you may not be stable. That is when medications are changed, and over time some drugs also lose their potency, means their ability to work effectively gets less, then your drugs will be changed. So if you keep going to one pharmacy to be buying the drug, it may not help you. So follow-up care is very important. With your follow-up goes investigations, and investigations are all done. Please don't take your health, or not only eye health, even other parts of your body in your hand. It is very vital to go for checkups. Okay, then for the caller, Mr. Onyebuchi, who is asking about buying drugs from the chemist, there might be cost discrepancies, but there are some protective measures a hospital may adopt in keeping your eye, cold chain preservation, temperature checks and all that, which may not be available at the chemist. And the chemist may not be too careful with parallel import and all that. So whatever his sources, we are not too sure he can dispense at a certain price. That is possible, but hospitals have their, as a matter of fact, they have their markups, but beyond that there are some vital checks they have to pass through. Those ones are observed by a hospital properly than a chemist. Especially there are numerous chemists. Some proper pharmacies still follow due process. Many chemists don't follow it, so I can't vouch for all of them.
All right, can't vouch for all of them. Well, time really not our friend this morning, but just before we go, if there is one message that every glaucoma patient listening to us this morning should remember after today's program, what would it be?
Yeah, take your eye check very seriously, and those medications your doctor has given to you, please read the labels. And if it is 6 hours, 8 hours, 12 hours, please stick to it. Do not convert the 6 hours to 12 hours and 12 hours to 1 day. It will not work for you. It is all aimed at making your sight better, at least preserving your sight for future. So it is in your hands to preserve your sight, and you can stick with this medication as prescribed to keep your vision going.
All right, to keep your vision going. Well, ladies and gentlemen, as we wrap up today's program, remember this, that glaucoma does not announce itself with pain. It quietly steals vision little by little. But while the vision already lost cannot be restored, the vision that you have can often be protected. The difference between keeping your sight and losing it may simply be your commitment to treatment. Because every eye drop you use as prescribed, every clinic appointment you keep, every instructions you follow from your eye specialist is another step towards protecting your eyesight. So, if you have been diagnosed with glaucoma, don't stop your medication because you feel better. Don't wait until your vision becomes blurry, and don't rely on guesswork or self-medication. Stick with your treatment, keep your appointments, and encourage your loved ones to have regular eye checkups, especially if glaucoma runs in the family. Okay, so our sincere appreciation goes to you, Doctor, for sharing your insight with us, and also to the Eye Specialist Hospital Enugu State for partnering with us on bringing this vital public health education to our listeners. Well, ladies and gentlemen, until next time, stay blessed, stay out of trouble. It's the weekend. Do not drink and drive.